Welcome back to the Knox County Schools Career Expo. This nursing program demonstration is brought to you by Pellissippi State Community College. Follow along with Katrina Hill, Nursing Coordinator, and Brian Gilpin, Nursing Advising Coordinator. Tour the Nursing Lab and the Simulation Center.
Hi, everybody. My name is Brian Gilpin. I am the advising coordinator here for the Pellissippi State Nursing Department. This is Katrina Hill, and we are going to be exploring and showing you a little bit about nursing and all that Pellissippi has to offer. I'm going to leave you, because I'll tell you how about the education side and how to get into the program. She does more the medical side. So since we have a patient here, I'm going to leave you with Katrina.
Good morning. Again, my name is Katrina Hill, and I'm the technical coordinator for the Skills and Simulation Lab here at Pellissippi State. And we are at our Strawberry Plains campus today and wanted to introduce you to one of our patients, SimMan. And we're just going to check on him before we finish the rest of our tour. How are you doing today? You doing okay? Let's check some of your vital signs. Again, we've got some very realistic equipment. We want to make things look as realistic as possible. We're going to check his blood pressure first and make sure he's doing okay. And again, he's a computerized mannequin, so we can check his heart sounds and lung sounds just like we can on a real person. All right, I think we are good to go. Your blood pressure looks good, and we'll be back in to check on you in just a few minutes. Let's go across the hall. I wanted to show you our medication room. We have a medication dispensing unit. This is just like they have in the hospital setting, the real thing. And we would be able to scan our patient, our medications, and pull those out. I'm going to pick up something for another patient in another room so that we'll have that. We also we can do injectable medications, which, again, it's not the real thing. Everything looks like the real thing, but it's simulated. It's not. This is just distilled water. And we also have some oral medications as well, but we won't need that for this next patient. All right, let's go across the hall. We are going to go into our pediatric lab. Brian, I'll let you just kind of do a scan and let them see what all we have. Let's check on our baby. Yeah. Were you able to hear the baby cry? And again, the baby's chest will rise and fall. And again, we have those heart sounds and lung sounds and belly sounds as well on the baby. Again, we can just check to make sure baby's doing okay. Baby stopped crying. And we're gonna check in on Cynthia over here. And we have Cynthia here, and again, we'll check on her. Again, we've got that patient monitor as well. We've got the patient monitor, so we can monitor her vital signs and make sure that she's doing okay. All right, let's go to the control room. Now, the control room is where we're able to control the mannequins that are in our simulation labs, just like that first patient that we saw. Brian, you want to tell them a little bit about our control room?
So what you're looking at here is basically the only one in the community college in the whole state of Tennessee. We can run 4 simulations at the same time with anything we want within these rooms. We do have state-of-the-art simulators, like you met our first patient. You will meet his twin brother shortly. And we can also do whatever we want in these rooms. We've had real live patients come in where we've had scenarios where we needed a person. I've been a patient many times here. So basically, we are able to do things in these labs with these two-way mirrors that no other community colleges in the state is. How we actually get in here, we'll stop and talk a little bit about this too. How do you actually get to become part of this program? Well, there's a lot of things you can do, even starting right now where you are in your educational path. But ultimately, what you'll need to do is when you come to the community college level, you will study a lot in your math and sciences. We do want a math course. There is one of them that is statistics. So every student has to take that, along with anatomy and physiology 1, 2, and microbiology. Those are courses that will really detail the human body, what it's made of, what it's attached to what, how it happens. Because when you get to nursing, it's very difficult for us to teach you how to fix a diseased kidney if you don't know where it is, what it does, what it's attached to, and you'll find that out in anatomy and physiology. You will also find out if nursing is right for you. My job here, even though it's in the nursing program, I'm not a nurse. My background is in college recruitment and student success. So my job is to help students get into nursing school, not become nurses, because I can't do it. Even when I'm being annoying, usually my fellow nurses all around me will basically tell me nursing stories and I run away very, very, very fast. So it may be for you, it may not. But when you get into anatomy and physiology and find out that the human body is basically just a balloon with lots of stuff inside, and when you poke holes in it, things come out. Can you handle that? Is that something that excites you? Is that something that frightens you? It frightens me, I'm running away. But if it does help you and it is something that you're really excited about, run towards it. We will be here forever. Our program has started in 2010. Our first graduating class was 2012. We'll show you our wall of fame in a second as we walk around, so you can see all of our nursing graduates and all that we put out to the community. Right now, nurses are more important than ever, especially with everything that we've gone through for the past year. The world needs nurses. That's what we're here to do. Okay, so we'll keep touring you around. We will have questions at the end too, and we can get more in detail about the courses that you're looking for. But we will turn you back over to Katrina in just a second.
Let's take a quick look at SimMan's computer over here. Just so you can kind of, for those of you techies out there, you might be a little more interested in that. But this is how we control the mannequin. So we can change everything from, again, all of his vital signs, his blood pressure, his heart rate. We can make him sweat. We can make him cry. We can even make him bleed if that's what the scenario asks for. So let's go move on to another room. And we will take a quick peek at our pediatric sim lab. So we do our pediatric simulations in here. And again, we can either use the older child, we have a baby that we can switch out. This is also the room that if we wanted to use a live patient, we can do that pretty easily in here as well. Let's go meet Sim Mom. This room is set aside for the Sim Mom simulator. And again, she is known as a high fidelity mannequin, just like that first patient that you met. And that just means there's a lot of bells and whistles, that everything she does. But this simulator actually gives birth. She gave birth to a beautiful baby girl yesterday. So we just wanted to check in on her, make sure that she's doing well. We're gonna go around so I can check on her blood pressure. All right, we'll check that and see how she's doing. Are you feeling okay right now? Good. All right, good. I'll be back in to get the baby in a little bit, and we'll take it to the nursery so you can get some sleep, okay? All right. We'll go across the hall to our OB skills lab. And again, we've got another adult female mannequin in here as well. Watch the thing. And again, when that mother comes into the hospital, we not only have just one patient, but we have two. So we'll have to take care of the mama. And again, we can change the scenario and for whatever signs and symptoms that we need her to have, we can program that into the computer. And this is one of our updated newer mannequins, and her skin feels a little more realistic than the older model. And again, we can give injections right into that arm just like we would a real person. So then we have our baby, the newborn. Everybody loves the newborn. And again, we've got, we have newborn. And again, you can see that the newborn is moving, and we can make the baby cry. We have the umbilical cord where we can actually feel the pulse through the umbilical cord as well. Now, let's go on down the hall, check out a few other rooms. Right, next, we are gonna just let you quickly look at our supply closet. It takes a lot of equipment and supplies to furnish the skills and simulation lab. So this is where we keep everything. But the next room that you're going to see is my all-time favorite.
This is our wall of fame too. So these are all of our graduates from the program starting in 2012. We will continue on as you go down. So every year we improved our program with not only campus locations and toys that we could play with, but certainly with students. So then we actually flip over to this side of the hall. So, and then we'll keep going as long as we can. And as you can see, there's lots of hallways here. So we're looking to fill this long hallway with graduating classes. Your picture could be down there somewhere.
All right. Again, this is my favorite room of all time. This is where all the behind the scenes magic actually really happens. So again, like I said earlier, we want to make things look as realistic as possible. And sometimes we may need for that patient to have a wound. So we can actually create our own. And so this is like silicone, and we mix equal parts of this, add in a little color, whatever we want the skin color to be. And
full makeup kits.
oh yes. Brush up there. All right. Then
What are you looking at? Why do we have body parts? What is this? A whole arm?
yes, that is an IV arm. We can connect bags of simulated blood to those IV arms, and then the students can learn how to start IVs. So we will I've just got a little bit of eyeshadow here. I'm going to take this in the wound And we're just gonna color that in a little bit. Okay, again, we wanna make this look as realistic as we can. Okay, and it may not look that way yet, but I promise you it will. And then I also have some simulated blood gel. Okay, it may look gross, but it's really cool. And we can take that just a little bit, and we'll put that on the inside. Okay, and then I've got some other simulated blood that I've mixed up. There's all kinds of recipes out there. All right. So there we go. And then voila. So lots of fun. Never know what we're gonna mix up. Let's go say hi to
Our main patient.
Our main patient. All right. Come on in. Yes. This is Mr. Smith. He's been in the hospital for a few days and just wanted to come in and check on him and see how he's doing. I need to check your blood pressure again too. Let's see. Oh, and we can also attach this to his finger and we can check the oxygen level and see if that's okay. All right, we'll check that. And we're gonna get his temperature. Oh, it looks like his oxygen level is dropping. And you can't see, but there's a little blue light on the inside of his mouth that will also tell us that his oxygen level is dropping. On a real person, the skin, it will turn blue around your mouth. So that's what that is simulating. So we need to get some oxygen. Get that in his nose, down his ears, hold that mask, nasal cannula on, and we're gonna, we'll start you out about 2 liters, okay? About 2 liters of oxygen. And again, we have a simulated head wall that simulates the real thing. We have a compressor that again, we'll simulate that oxygen as well as suction if the students need to practice that. Let me listen to that cough. You've got a nasty cough. How are you feeling right now?
Not very good.
You mentioned that you were nauseous earlier.
I really am nauseous. Do you have anything for that?
I do. I stopped in the medication room earlier on my way here so that we can give you something for that nausea. Okay. And again, I've got my medication and we're going to check. Can you verify your name and date of birth for me, Mr. Smith?
John Smith, 9/25/83.
Okay, that looks right. Are you allergic to anything?
I don't think so.
Now I'm going to draw up this medication, and he has an IV started here, and so I'm just going to start that in here. Okay, I'll go ahead and give that. Draw this up. And we always want to make sure that we are safe. We have a little safety thing here to cover that needle, okay, so that we don't stick ourselves. Good. Give our medication. Now, some medications we want to give a little slower than others, so we always have to check that medication to make sure how fast or how slow that we're supposed to give it. And then once we give it, then we'll ask our patient after we wait a few minutes, we ask our patient how they're feeling. We'll pretend like it's been about 15 or 20 minutes. How are you feeling now, Mr. Smith? Is that nausea getting any better?
So much better.
Awesome. That is wonderful. And again, when the students come in, we will have a scenario already programmed and written up. So the students will come in groups of like 3 or 4, and they will read about their patient and look over all of the physician orders and all of that. They will have to come in and take care of that patient, again, just like it's a real person. And they would be able to call the physician if there are any other symptoms that did come up that they would need to get further orders for. And again, we can change all of his heart sounds, his lung sounds, the belly sounds, again, to create any type of patient that we need to go over for that particular time that of what they're studying.
So let's talk a little bit about our actual program. How many locations does Pellissippi have? How many of these guys do we have?
Oh, goodness. We have 3 locations of where students can go to study. So we have the Strawberry Plains.
That's right here.
Yes. And then we have the Blount County campus. That's near Maryville.
Okay, way past the airport.
Right. And then also Magnolia Avenue.
And that's downtown. You can see downtown from there?
Exactly. Yep. We have 3 different locations, and we have one of these guys at each campus.
At every one?
Yes.
What about mom? Is mom at everyone?
No, mom's just here.
Okay.
Mom is just here.
Okay, so there's some things that you can do at some campuses, but so other times you have to come to the main. Where else do you send them out in the world?
Oh, our students go to really all of the area hospitals to do those clinicals.
Oh, okay, so that's when they go out in person and literally work hands-on in the hospital settings as they're learning their trade. Of course, they're under a nurse and one of our instructors, but you will be hands-on, literally in the hospitals. We've sent them all over the place. Our graduates, once you're done and we put the letters after your name, and we change a lot of things about you. We'll change the way you look at the world, the way you think about the world, and then ultimately we'll add some letters after your name. I call it alphabet soup. We offer the RN. There's also BSNs and MSNs, and doctorates, and all sorts of letters that are thrown out there. But what we offer is the RN. So we want to send our patients and send our students out with the best information possible. These guys, we have total control over what we do with them, how we enact scenarios. Yes. Does real life work that way?
No,
it doesn't. We wish it did, but it does not. So we do really send them out into the world and get them through there. Our graduates will, especially right now, they have no problems getting a job. If I tell all my students that I see coming up and trying to get into nursing, if you put letters after your name, you'll have a job. In this area, our nurses make anywhere between 38 and 50-ish thousand a year, depending on where they are and when they work. I've met some RNs that make upwards of $120,000 a year. It depends on where you are. Are you in the hospital? Are you in the doctor's office? Are you working with?
Do you have any specialty certifications?
Do you work with a sports team? Do you do whatever? There is a lot of different ways. Travel nursing, that is a popular one. I get a lot of students who say, hey, I want to go neonatal. Can I work with babies? And yes, absolutely. Really what we do here is a generalist degree. You become an RN, and then from there, you go into your specialties once you actually graduate. That is something that we brag about to our graduates. So here's how our program works. You come to Pellissippi, you take what we call general education courses. Those are your Englishes, those are your public speaking, those are your math, those are your anatomy and physiologies. When you feel ready, you then apply to nursing school. Nursing school, we have two different starts. We have a fall start and a spring start, where we bring upwards of 100 in for the fall and 40 in for the spring. So we add about 140 students per year. Once you are with us, you're with us for about 2 years. Our fall program is 4 semesters of work, fall, spring, skip summer, fall, spring. And then our spring has another summer in there just because the calendar wise. But you're with us for 2 years. After those 2 years, we will hand you a degree. That is called your AASN nursing degree. So your Associates of Applied Science in Nursing. From there, can you get a job that next day?
No,
Why not?
because you have to go take your NCLEX.
Oh, well, that is
You have to pass the exam before you can actually go out and get a job.
what she's referring to is the licensing exam. The degree is just step one. That gets your foot in the door to actually take a licensing exam called the NCLEX. Once you pass that, plus your degree equals a registered nurse. Pellissippi is very, very, very proud to report that last year, out of 75 students, we had 100% NCLEX pass rate. So all of our students passed it the very first time. The year before that, we were building up to that. We were at 98%. We only had one student who took it and was not successful that first time, but they were successful the second time. So we're really good at what we do, and we hope that we can continue to do what we do with all the fun toys that we have and all the great people that we have in our department. So
But what can these students do now?
what can you do now? As you get to high school, work on math and sciences. You can also do things such as dual enrollment, and that is where you are a high school student and a college student at the same time. There is also AP courses, advanced placement, where you could earn college credit. So there are things you can do. I've met students that have applied for our program that graduated high school the same day that they also graduated with an associate's degree. Anything is possible. If you have questions, you're always welcome to contact us. I've met with high school students. As far as if you have questions, we are here to answer them. We can kind of tour you around once we get back to the way things were. We can do virtual tours just like this at any point. So if you have any questions of what we do here at Pellissippi State Department of Nursing, please let us know.
Thank you both for the tour and for the great information that you have about your nursing program. We do have some student questions that have come up, and I would like to ask those for the students. One is, how do you get into the nursing program? What are the requirements?
Well, basically for that is just to apply. With that, you do need at least one college credit in order to be eligible. There are 8 classes that we are looking for totally. They are English 1010, so that's English 101 basically. There's public speaking, there is introduction to psychology, there is a humanities course from a list of a couple different ones. They're like theater and music and things like that. Then it's the harder math and sciences. It is statistics, it is anatomy and physiology 1, anatomy and physiology 2, and then microbiology. So you take those courses, and how fast you get through them is totally up to you. When you feel you are ready to start nursing, you apply. If you get selected out of the 100 in the fall or the 40 in the spring, we're offered a seat in our nursing program, and you have a seat, and we go from there.
You also mentioned travel nursing, and we've had a question, what exactly is a travel nurse?
a travel nurse, your Tennessee state license. So you go and take the NCLEX. That is part of what we call a compact state. So that means your license is not only good in the state of Tennessee, but it's good in other states. So what you do there is literally, there are companies that will pay nurses to literally travel around the country and work in different facilities. The massive advantages, especially if you're young and that's, hey, I want to travel and see the world. Travel nurses make a lot of money. I don't really know how and why they do that and they transport them, but the world needs nurses. Certain spots need them more than others. So they will find a spot where you are best used and they're going to send you there. So a lot of people, I talk to a lot of people that really are interested in travel nursing.
Thank you, Katrina and Brian, and we appreciate all that you've shared with us about Pellissippi. If you will, we want to thank you for your time today and thank you for joining us.
Thank you.